everyone, welcome to my channel, the NP Mentor. I am happy you're here. I am Daphne, a nurse practitioner and also the founder of the NP Mentor. I offer mentorship to nursing students, nurse practitioner students, and UNPs. But on this page, I help nursing and NP students stop feeling overwhelmed and start feeling confident. I share exam passing tips, real world clinical pearls, and shortcuts that school doesn't teach you. The stuff that you actually need to know. Don't forget to subscribe and also leave me a thumbs up at the end of this video to let me know how this is helping you, also how I can better serve you. The topic today is hypertension medications. In this presentation, we will review the most important hypertension medication classes you must know for exams and clinical practice. And on this slide, if you'd like to, you can pause for a little bit. These are the main antihypertensive drug classes you'll see on any type of nursing exam, like NCLEX, AANP, and also in practice. So make sure that you know about the thiazide diuretics, the ACE, the ARBs, the calcium channel blockers, the beta blockers, and others. Let's talk about thiazides, medications such as hydrochlorothiazides. These medications, they are first line. The way they work, they increase sodium and water excretion. One thing that is very important for you to remember, make sure you check the labs. Watch potassium levels and glucose, especially in diabetic patients. Now, let's talk about ACE inhibitors. Medications such as lisinopril and enalapril. Do you see something about these medications? Yes, they all end in pril. You need to remember these medications, they protect the kidneys, but they can cause cough and angioedema. So it's very important to educate your patients to report any signs of cough or facial swelling. And the exam loves to test about this. You should never use these medications in pregnancy because it's contraindicated. Now, let's talk about ARBs. They are similar to ACE medications, but without cough. Some examples are losartan, valsartan. Can you see something similar? Yes, they all end in artan. So these medications, the side effects are hyperkalemia and dizziness. So you still have to monitor potassium and kidney function. Now, let's move on to the calcium channel blockers. They are divided into dihydropyridines such as amlodipine and the non-dihydropyridines such as verapamil and diltiazem. One important thing for you to remember, edema is very common, and watch for bradycardia. Let's talk about the beta blockers. They are not first line unless there is CAD or heart failure. And remember, they can mask hypoglycemia. So some examples are metoprolol, atenolol. These medications, they end in LOL, LOL. Next, we have the aldosterone antagonist. They are great for resistant hypertension, but watch potassium closely. As a provider, you always want to tailor medication choice to the patient's comorbidities and demographics. Always think about your special populations. Your diabetic patients, make sure they are on either an ACE or an ARB. Your black patients, on a thiazide or a calcium channel blocker. Your pregnant patients, they can either be on metaldopa, nifedipine, or labetalol. Something that is very important for you to know, the difference between urgency and emergency. For urgency, it's okay to do oral meds. But for emergency, that would require IV meds and also ICU care. That is why it is important to treat hypertension properly. On this slide, these side effects are frequently tested and commonly seen in practice. For your ACE, remember cough, thiazides, low potassium, calcium channel blockers, remember edema, beta blockers, they mask hypoglycemia. Some key takeaways. You always want to start slow, titrate slowly, and always reinforce lifestyle modifications because lifestyle modifications plus meds save lives. You made it to the end. So now let's do a quick Q&A. We have a 58-year-old African American male with a history of hypertension and gout. The patient presents for blood pressure follow-up. His blood pressure today is 154/92 despite lifestyle modifications. Current labs show uric acid 9.2, potassium 4.2, and creatinine 1.0 and A1C 5.6. The patient has no issue of CAD or heart failure. Which of the following is the most appropriate initial antihypertensive medication? Is it A, B, C, or D? So the correct answer for this one is C, amlodipine, which is a calcium channel blocker. You need to remember the key guideline points. So in African American patients, first line therapy is thiazide diuretics or calcium channel blockers. But in this case, the patient has gout, so you cannot do a thiazide because that will worsen the gout. So here you go. Thank you for watching this video. I'll see you again next week. Remember to subscribe and also give this video a thumbs up if you liked and enjoyed the content. I'll see you again next week. Wednesday, we'll talk about another topic. Thank you.